Hello, and thank you for joining us for our free webinar, Practicing Safe Facial Cupping and Gua Sha During COVID-19, featuring Michelle Gellis. My name is Jeff Bloom, Education Marketing Manager here at L.A.C OMS. For over 40 years, L.A.C OMS has been striving to promote the growth of the acupuncture industry by providing quality products, great prices, and the best customer service, as well as supporting the many schools and continuing education efforts available. With our free webinar series, we intend to provide free educational opportunities taught by some of our industry's most renowned practitioners and educators. I would like to take a moment to acclimate you to the webinar room. We recommend viewing the webinar in Chrome, Firefox, or Safari, as you can experience slowness in other browsers. To the right of the video screen, you will see 3 tabs: Chat, Questions, and Polls. To chat with other attendees and communicate any technical difficulties, please use the Chat tab. For questions of the guest speaker, please make sure to use the Questions tab to assure that we see them at the end of the lecture during Q&A. Please note that each webinar is recorded, and immediately following the conclusion of the webinar, you will receive an email with a link to view the video on demand. You may always visit our blog, use the free webinar tag to find all of our previously recorded events. From sports acupuncture to Chinese herbs to practice management, you'll find something interesting for every practitioner on the L.A.C OMS blog. I would also like to mention a few new great features at L.A.C OMS. We've just launched our new L.A.C Direct Dispensary program to allow practitioners to recommend products to patients and receive a commission on purchases. We will share a link in the chat to our blog where you can learn more on how to access this program using your current L.A.C OMS account. Also to note that next week we will be releasing some new enhancements for this program, so stay tuned. We also now have the ability to receive text alerts about inventory updates and other important information. All you need to do is text the supply, SUPPLY, to the number 855-358-3253. We're going to put information for both of these things into the box. Now for our featured speaker, we are proud to introduce Michelle Gellis. Michelle is a licensed and board-certified acupuncture physician. She's been a faculty and clinic supervisor at Maryland University of Integrated Health since 2004. She holds the distinction of being one of the very few acupuncturists in the country certified to teach facial acupuncture internationally, and she's been doing so for 15 years. Please join me in welcoming Michelle Gellis.
Thanks, Jeff. Hi, everyone, and welcome to my presentation on practicing facial cupping and Gua Sha safely during COVID-19. I put this presentation together because for a lot of us, especially those of us who spend any amount of time treating our patients' faces, it can be a little daunting if our patients are wearing a mask. How are we going to continue doing what we do? And for a lot of our patients, for many patients, they're still self-quarantining, and some are just starting to poke their noses out after being on lockdown for many weeks. I know myself, I am still self-quarantined. I live in the state of Maryland, and our numbers are still rising. So haven't been to a salon or had any of my usual primping done. And for a lot of people, this is part of their routine. And so now they are looking outside their little bubble, and they would like to be tended to. I know my patients have started texting me. Maryland opens up, I think Monday. The governor has said that certain services will be allowable. So this was my little joke for for how some of our patients will look once they haven't been getting their Botox treatments or fillers, or in some cases just facials or their cosmetic acupuncture treatments. I did want to mention I'm having a sale on all my recorded webinars through the end of this month. So if you go to my website, facialacupunctureclasses.com, there will be in-depth instruction on, I broken it down to make it affordable. I broke it down into 5 different modules, the whole certification class, including my advanced class. And then there are 2 classes on treating neuromuscular facial conditions. And so that's not cosmetic, it's Bell's palsy, TMJ, trigeminal neuralgia, those things. And I even have a 3CEU webinar that Lonnie Jarrett did on the face and Chinese medicine. Cupping in Gua Sha, in addition to using needles on the face, or instead of using needles on the face, is really a wonderful opportunity for us to expand our practice. Many times people call me and they're a little leery of the needles, and so they start out getting cupping in Gua Sha on their face, and they can kind of ease into the whole idea of cosmetic acupuncture. And this is also something that you can teach your patients to do through telemedicine. If you yourself are not starting back up just yet, it's great. You can sell them a set of cups and Gua Sha tools, and you can teach them through telemedicine how to tend to their own faces. And as I mentioned, just because of the lack of outside care that patients are getting, they really are looking for ways to take care of themselves. A lot of our patients have been consuming a lot of alcohol. They're under a tremendous amount of stress. They're not getting enough sleep, or they're getting too much sleep. They're caring for their children round the clock because schools haven't opened, and they're in close contact with their loved ones. So all of this is going to show up on the face. When I think about cosmetic acupuncture and doing facial cupping in Gua Sha, what really is important to have in your mind is that when you're treating the outside, you're really treating the inside. It's not just some superficial thing that we're doing to make people look better, because again, you think about the entry-exit points on the face, you think about how all of the meridians have some sort of relevance to the face, and there's either a sister meridian or a meridian on the face. So by treating the outside, you're treating the inside as well. And when I teach my facial acupuncture classes, I do a full body treatment, because when you're treating the inside, you're treating the outside. If you're going to be doing any telemedicine with your patients, this is a great time to get into the emotional underpinnings of what's been going on with them, because you're dealing, again, their emotions show up on their face, the loneliness, the fear, the grief, the anger, the over-nurturing, it's all going to be etched on their face. Our skin on our face is the only place on our body where our skin is attached to muscle, and so the face itself is very unique. So talk to them about what they're going through, stress reduction, what type of self-care are they doing, and if you're dealing with a telemedicine situation, you can use ear seeds, acupressure, those types of things to help them on. Additionally, nutritional support, lifestyle support, what are they eating, what are they drinking, this is all part of their skincare. And so the facial cupping and the Gua Sha, in unison with these other things that you can provide, can really help your patients, in addition to either a jade roller or a derma roller. So either in between treatments or instead of them actually coming into your office, these are all therapies that you can offer to your patients. In fact, I have 2 patients tomorrow that I have sold cups to and Gua Sha tools, and I'm going to be doing some telehealth with them. I put this picture in here. This was me teaching a class. I think I was in Asheville, North Carolina. And I put this up there because of the lines on my face. And again, the lines on our face are really an outward manifestation of what's going on in our inner world. So this can help you if you're doing your diagnosis, your patient diagnosis, before they come in through telehealth. Instead of doing it in your office, you can use some of the facial cues and some facial diagnosis in order to decide how you're going to treat your patients. And we're going to talk about that a little more in just a second. So before your patient comes in for facial cupping or Gua Sha, there is screening that has to be done, and this can be done on the phone or through telehealth. But things like high blood pressure, issues with bruising, people that bruise very easily, they usually know that they bruise easily, and facial cupping and Gua Sha may not be the best modality for them. People who have severe or frequent migraines, doing cupping can really bring a lot of energy up to the head, so you want to be aware of that. If they've had any sort of treatment on their face, whether it's dermabrasion, chemical peel, Botox, fillers, anything like that, you want to be aware of it because they need to speak to whoever has done the treatment to them and find out whether or not it's okay for them to be doing cupping and Gua Sha. With things like Botox, it can be 2 weeks before the Botox even starts to take effect, and you don't want to be moving the Botox around. And the cupping and Gua Sha, if they have it done like a month after the Botox, it can make it wear off. So these are things to think about. If the person has severe acne, like pustule acne, you don't want to be doing cupping or Gua Sha over that. And if the person is prone to facial herpes, it's something you need to know about. It can stimulate the nerves and possibly cause an outbreak. Of course, any kind of open sores on the face, any cuts, any wounds, if they've recently had any surgery on their face, any infections, poison ivy, psoriasis, eczema, these types of things, you don't want to be cupping or doing Gua Sha over them. Any sort of eye infection, if they've recently had any sort of dental work done, you don't want to be taking a Gua Sha tool and moving it around on their face. As far as pregnancy, the way that I teach facial cupping, I spend time cupping over a lot of the intestine and stomach points, not just moving the cups around, but actually suctioning, releasing, so stimulating these points. Probably not a great idea if someone is pregnant to be suctioning on a lot of the stomach and large intestine points, which can have a very descending, releasing action. If the person has had chemotherapy, radiation, anything medical, any severe medical conditions, they really should check with their doctor before undergoing facial cupping and Gua Sha. Also, if the person is prone to blood clots, if they've had blood clots in the past, you're going to be taking these cups and moving them on the patient's neck. So you don't want to be possibly risking a stroke or throwing a blood clot that might be lodged. So when you're talking to your patients, you want to find out what their biggest concern is, what their biggest concern is. You don't tell them what you think needs to be worked on. Just ask them what their concerns are, and anything that they really want you to concentrate on. Do they have concerns about the color of their skin, any facial puffiness? Facial cupping and Gua Sha is great for under eye puffiness, any stagnation. It moves lymph. It stimulates the blood, stimulates the muscles. It helps to produce collagen. So these are a lot of the benefits, and you do need to know, however, what's going on with your patient before taking cups and just running them all over their face. As far as allergies, the cupping oil I like is argan oil, and some oils have different coconut oil, things that people might be allergic to. So you want to find out if they have any allergies before you start taking cupping oil and putting it on their face. It can get absorbed in the skin. And also find out if their skin is sensitive. They might have a sensitivity to one of the ingredients in one of the products they're using. If they've had any surgery on their face, you definitely want to wait until it is healed. Something minor, like a mole removed, as long as their doctor has given them, the green light, it's fine. But if they've had a facelift or major surgery, I would wait up to a year before doing cupping on their face, because it can take that long for the swelling to go down. So when you're talking to your patient, if you're doing your intake, let's say through telehealth or even in person, the face is going to give clues to ways that they might need treatment. And the picture on the left is just some of the areas of the face that will show some of the different organs and where they might be in or out of balance. The picture on the right is from Lillian Bridges, and it has some of the facial lines. This is from a Chinese face reading, and if you haven't studied with her, she's delightful. One of her students teaches in my module 2 of my facial acupuncture class. He does a lecture, Cameron Bishop does a lecture on Chinese face reading using Lillian Bridges' information. Another way you can diagnose your patient is through a 5-element model, and 5-element acupuncture is great for diagnosing someone because you don't even have to feel their pulses. You can just look at their facial color and the sound of their voice and what is the underlying emotion that's prevalent. And it's fabulous, again, for that intake. Are they groaning? Are they weeping? If you can't see their facial color really well, have them move either their phone or their laptop into a different light. You can have them take a picture of themselves and send it to you so you can get a better idea of what's going on color-wise. Tongue diagnosis can also get done ahead of time, which is great. Same thing. Look at their tongue on the camera and then perhaps have them take a picture and send it to you. And that way you can get a good read for what's going on internally. I don't recommend having your patient take their own pulse, but at the very least, you can get an idea if their pulse is rapid or slow. They can either count, or if they have one of those Fitbit or Apple Watch thingy. I'm very old. The gizmos, they can see what their pulse rate is, and that can give you some more information as well. So let's talk a little bit about aging and some of the signs of aging. And one of the things that you'll still be able to do, even if your patient's wearing a mask, is look at their eyes and the eyelids. One of the signs of aging is the eyelids will start to droop, and this is called hooding. The skin around the eyes gets thin, and they have wrinkles, fine lines under their eyes. The tear troughs can start to kind of sink down. And then crow's feet from smiling. Also, diagnostically, if someone has lines on their forehead, one line is considered gallbladder. It's when you're very angry. Sometimes people who are very stern. And the 2 lines is more gallbladder, kind of decision making. It can be an earth thing. It can have to do with showing sympathy. But just watching your patient will give you some clues as to the lines between their eyes. The kidneys are going to show up underneath the eyes, dark circles, and the spleen will show itself frequently in what we call marionette lines. So the marionette lines go from the corners of the lips down. Of course, if your patient's wearing a mask in the room with you, you won't be able to see those, but this is why it's great to do an intake like this. They can have the mask off, and you can get a lot of information up front before they come in, so that you'll know what to do. And the reason why this is because, of course, the spleen holds things up. And so if someone looks like they're frowning when they're not frowning, then that can also be a clue. And in my, I think on my website, but definitely in my Facebook group, I have a Facebook group called Facial Acupuncture, and I have some before and after pictures. I had a patient who was in her 60s, and after about 6 treatments, I treated her spleen quite heavily, and did some work on her face. And she said her husband always used to ask her why she was sad, and after a few treatments, the frown lines disappeared, which was really pretty neat. So some other ways of diagnosis, if you're looking on the left, lines on the top of the lips can be from smoking, drinking out of water bottles, or pursing your lips, which can be a sign of over-nurturing. Stress lines, so lines that go from the edges of your nose down to the corners of your mouth, those are called nasolabial lines, and they can be from smiling a lot, but they can also be a spleen thing, or someone loses a lot of weight. But if the lines are behind that, then that has to do with stress, if someone has a lot of stress. And the lines in the chin down here, those are from overworking. So you can see I don't know if you can see my arrow, but the nasolabial lines and the marionette lines, these are hooded eyelids. And then what we have over here, someone with some frown lines. And these lines right here, which you don't see very often, but they're called wolf lines. And if you see them, you need to just run away from that person, because the only way to get those is from making a very, very angry expression. So it took me a while to actually find a photograph of someone who had wolf lines, but they are from people who are very, very angry and yell a lot. So facial cupping and Gua Sha. Here's a couple of pictures from my classes. When I do Gua Sha, I use 2 Gua Sha tools. When I teach my patients, I just tell them to use one. And even in my classes, I tell my students to just start off with one. But when I do cupping, I only use 1 cup. And so the benefits to facial cupping, I kind of touched on this. Helps to smooth out some of those fine lines because it brings a lot of blood and qi out to the skin. And it helps to relax overly tense muscles, moves out stagnant lymph, fluids, toxins, and your face will appear tighter, more toned, and your lymphatic system will function better. And it can help a lot with rosacea and other sort of heat conditions that show up in the face. And it also helps to strengthen the vascular integrity of your face. The cups that I like, L.A sells them. They are glass, not plastic. So they're made out of glass. And then the rubber part on the top is nice and small. And I like these because they're hand blown. They glide smoothly. And I usually just use 2 of them. They come in a set of 4. The big one is great if you want to use it on your legs. And the tiny one is nice to stimulate points. I actually use it sometimes if I want to stimulate bladder 1 on a patient, but I mainly just use the 2 middle ones. The Gua Sha tools that I use that I like, L.A also sells. They're made out of jade, and they are shaped like this, and each edge of the tool has a different purpose. So the U part goes along the jawline and along the cheeks, and the knobby part right here is great for stimulating point. And then the flat edge is really nice when you're working along the temporalis, working on the forehead, and working down the trapezius. And jade is wonderful. It's very cooling, and it actually creates a electrostatic charge when it touches the skin. The oil that I use, I have been carrying and selling facial oil for many years, and I just started private labeling, so you are the first people to hear about it. But you can also get it from my website, and it has CBD and arnica in it, and it's argan oil. And argan oil is wonderful because most people are not allergic to it, and the CBD and the arnica have anti-inflammatory properties. And so that's the deal with that. It comes in a big size with a pump for your back bar, or a little tiny size to sell to your patients, or if you just want to try it out. So there I am sitting on my back porch, modeling a mask. And so what do you do? Here we are, right? A lot of us are treating patients and they're wearing masks. So not a whole lot of the face is exposed, but the good news is there are things that you can do. Now, I had done a lecture a few weeks ago, about a month ago, for L.A, and there's a link to that on their site. And if you can't find it, I have a link to it on my website, Facial Acupuncture Classes, where I go over how to do facial acupuncture on someone who's wearing a mask. So kind of alternative points that you can use. But I didn't really talk about the cupping in Gua Sha. So if you're interested in the more of the acupuncture part, you can refer back to my previous lecture, and it's free. It's completely free, so help yourself. Facial cupping in Gua Sha, the way that I teach it is I use acupuncture points as landmarks. So if you look at the landscape face and the neck, there's really just a few points that you can't access with the cups. So what I've been telling practitioners is you are going to access the points that you can, and the points that you can't access with the cup, the Gua Sha tool can be used right over the mask to stimulate these points, and you can even use the side of the Gua Sha tool to do some of your heavy work for you. So here's me. You gotta love working in them, right? Stimulating some of the acupuncture points that I would normally teach in class. So working under the chin, up into the ear, suctioning and releasing down the neck. You never want to drag the cup up or down the neck, but suctioning and releasing down the SEM, going underneath the clavicle. You can work right in front of the ear, work all under here. You can work around the eye area, the forehead. So it's really just this little piece right here where you wouldn't be able to do the cupping. Now the Gua Sha, again, because it doesn't require a suctioning, you can still do Gua Sha like you would on any areas that are exposed along the clavicle. You can even go, I put a mask on and I was trying it, you can go right along your jawline. Using the corner of the tool, you can stimulate right through the mask, any of the stuff that you would normally do when you're doing your facial Gua Sha. And so again, under the chin, you never want to do Gua Sha on the throat. It's just nasty. And there I am with using a Gua Sha tool right on the mask. And so this, in combination with any body points that you would be doing acupuncture on, is going to open the meridians up, bring energy to the area. And although it's not 100% the same, we're all adjusting to kind of a new normal now. And since most of the face can be accessed with our needles, and certainly the body points can be accessed, even if your patient is wearing a mask, you can still use these techniques as kind of a workaround. For example, if you had a patient that had Bell's palsy, and so they weren't coming to you for cosmetic acupuncture, but they had Bell's, you can still do the body points that are going to affect the face, things like large intestine 4, stomach 36, stomach 44, and then either cupping or Gua Sha in the areas that you might be able to needle, or in the areas that you do needle, you needle, and then you can follow up with your cupping and Gua Sha. The same with TMJ. You can do the body points that correspond to whatever the TCM diagnosis is, and then you do your cupping or Gua Sha at gallbladder 2, Sanjiao 21, stomach 7, you could probably get right around here. And then doing Gua Sha around the temporalis muscle. So you use the sides of the tools and you just work back and press pretty hard along the temporalis. This can really help tremendously with TMJ. It helps to relax the entire face. So I'm doing in like 45 minutes what normally would be like a 45-hour class. But one thing I don't want to forget to impress upon you is when you're doing Gua Sha on the face, and I would strongly encourage you to not try to wing it after this little mini session. Go and take one of my webinars, or this weekend I'm actually teaching a 3-day certification class, Saturday, Sunday, Monday, and you can just do the weekend piece if you want. But anyway, you're going for Gua, but not the Sha. So you should not, when you're working on your patient's face with Gua Sha tools, you're not doing the same type of scraping motion that you would be doing if you were working on their back or their shoulder, or like the way you would normally do Gua Sha. So it's a very, you go in one direction and you work firmly, but you move quickly and you use just enough pressure on the face when you're working around to get things moving and to stimulate things, but not so much that you're going to leave marks on the face. And the same thing with the cups. Cupping should not leave cupping marks on your patient's face. The cups, you have to put enough oil on your hands, and then the cup should be moving pretty much all the time when you're doing cupping. Let's see. So this is me kind of doing a little Gua Sha along the temporalis, and then the way I like to end my Gua Sha session is taking the tool and starting right. I don't know if you guys can see me because I can't see myself, but starting right at the base of the skull. Oh, thanks. Starting at the base of the skull and working right down the trapezius. You want to stay either on or in back of the SCM. You don't want to be in this part of the neck. So you work right down the trapezius, and you can press pretty hard. So if your patient was on the table, you're just working right down the trapezius all the way down. It feels absolutely wonderful. Even doing it to yourself feels good. So I would definitely recommend that you end your Gua Sha sessions like that. Okay, Jeff, thanks. So I couldn't help myself. All of the barriers and social distancing that's going on, this popped up. For those of you who are old enough to remember the show Get Smart, these reminded me of the cone of silence, and it showed up on social media somewhere. But what if your patient isn't wearing a mask? And I've spoken to plenty of practitioners, and I don't know if it's a state-by-state thing. I know in Maryland, we're required to wear a mask, but our patients are not required to wear a mask. So if they're not wearing a mask, how can you treat? What are some options for treating your patient's face safely and still protecting yourself and the people that come in after your patients leave without the cone of silence? So most importantly, protect yourself. This is actually a very good friend of mine. He's an acupuncturist in New York City, and he's also a nurse. And he sent me this picture of himself all masked up when he was at work in one of the hospitals in New York City. So having a mask and a face shield will help to protect you if your patient coughs or sneezes and you're working on their face. And additionally, companies are coming out with, and I purchased this actual model, but I am having one made that is foldable, collapsible, because I travel and teach for a living, and having one that could fold up with possibly some smaller holes works best for me. So if your patient is in there and they cough or they sneeze, it doesn't go flying all over the room. And then I've read different things about the efficacy of the HEPA filters with the UVC lights, but I figure it can't hurt, so I got one of those as well. But as I mentioned, I'm not treating yet. I think when I start treating, I'm going to be treating my patients out on my back. My office is in my home, so I think I'll be treating my patients out on the back porch. I have a screened-in porch. We'll start there. I don't remember why I put this slide up. Telehealth. Oh, so if you decide that what you want to do right now is just get some cups and Gua Sha tools and sell them to your patients, you can go on my website, and there's step-by-step instructions. It's not as in-depth or as detailed as what you would be doing if you were doing facial cupping on your patient, but this is like easy to follow for them. And so these instructions will be on I have a website for my derma roller company, and I'll make sure, if you don't want to go to the website or you don't remember, I'll make sure Jeff gets a copy of these so that you guys have them. And then this is for the Gua Sha. Again, it's step-by-step for your patients so they can do it at home in between treatments, or if they're not comfortable coming in yet. That's that. Something else that you can recommend to your patients, which I love, are ear seeds, ear magnets, and there's a whole array of points on the earlobe that correspond to the face. So this is something that can help to supplement your treatments as well. Last but not least, microneedling. This is great, again, between treatments, or if you have a patient who's not comfortable coming in yet, you can get some derma rollers, sell them a derma roller, or I guess the way LASA is set up now, you can just send them right to the LASA site, and then you get some sort of a commission. Jeff can speak to that a little more. But anyway, the AccuLift derma rollers are the only derma rollers that are approved for use in the treatment room. And so really teaching a patient how to use a microneedling device, another telemedicine session you can do, but they're pretty easy. And they look like this. They have teeny tiny little needles, just long enough to go through the epidermis into the dermal layer. They stimulate collagen. You just roll it on the skin, up and down, left to right, on a diagonal. It's like aerating your lawn. And they're great for enhancing the absorption rate of any serums. And they're wonderful for any depressed scars, stretch marks. And there's face rollers and there's body rollers for larger areas of the body. And this is great patient self-care. And so this is a picture of a derma roller or someone using a derma roller. And then these other two things here that look like little glass bottles. You put serum in them, and they're pretty much the same. You put the serum in them, and then one of them is a hydro roller, and you can just roll the serum right into the skin, and they're great for traveling because you don't have to take serum and a derma roller with you. And the other one is a hydro needle. It's got tiny little gold needles on it, and you just set your serum in. And then L.A.C also sells the Acupuncture sanitizing tablets. It's great for your cups and your derma roller products, your Gua Sha tools, and it kills bacteria. It has not been tested on COVID, so I always tell, well, the derma rollers are single person use. You don't go from person to person with these. But with the cups and the Gua Sha tools, either alcohol wipes or barbicipes between patients, and then at the end of the day, you can soak them with a sanitizing tablet just to get any excess bacteria or anything that might be lurking in the cups. So, Jeff, you want to do the sanitizing tablet video? Are you there? I don't know where he is. Okay, well, I'm just going to keep moving along. Wait, maybe he needs a second. Ah, here we go. It's a short one. And it's a little jumpy, but so essentially that's, you would just take a tablet with hot water and you put it in a bowl, and you would put your Gua Sha tools, and you put your cups, and there you go. You don't want to put the rubber part in. And okay. And I have a snippet. This is a little preview of my demo from my facial cupping class. The actual demo's like 20 minutes long, so this is just like a minute and a half. And once Jeff starts, kind of talk through it. Or not. Well, there's me in my treatment room. Okay. So there's no sound, and this is definitely a little jumpy, but I think what I'm saying is you're going to take some oil, you're going to put it on your hands, you put it on your patient's face, and this is definitely going in slow-mo. So you turn your patient's head to the side, and then you would work right down the SCM, staying on the SCM, suctioning and releasing, and then you go underneath the clavicle, and this is how you do a lymphatic drainage, right to like lung 1, and you would do this like 3 times, and then you would turn your patient's head forward, and then you would start the way I like to start my facial cupping is by opening up the entry and exit points on the face before I start cupping on their face. And that's, I think that's the end. The last slide. Yes. So I hope you found that informative. I think we're going to open up for Q&A.
All right. I do apologize for the kind of slow onset of those videos. I did my best. We do have a fair amount of questions that came in, so let's get right into them.
Okay.
Let's see. Let's see. How often should a woman in her middle ages be using her jade roller? And would you use it with a product or with no product?
A jade roller?
Mm-hmm.
Well, you could use a jade roller as often as you want. I actually have one right here on my desk. And I just, when I'm sitting and I'm working and I'm thinking, I just use it. And I keep oil, cupping oil, right on my desk as well. So the more the better. You can't over roll. Now, with the Gua Sha and the king, you really want, because it's actually a treatment, the roller just kind of feels good. It doesn't do a whole heck of a lot. But I know they're very popular now. You see them everywhere. I was in Target and I saw them, the jade rollers. But
they're in Sky Mall now.
Sky Mall. They still have Mall.
They do.
But the Gua Sha tools, every other day, I would give the muscles in the face a chance to like rest after you did Gua Sha.
Alrighty, and when you were talking about different,
anyway, what's middle age? I'm 59. Am I middle age? Am I beyond middle age?
I think that's for another webinar. Somebody wanted to know about, you were saying if people have sensitivities to, certain things that you put on their face. What if they don't know about sensitivity or an allergic response beforehand?
Well, I've been using the same oil for, I don't even know how many years. And, if someone's going to have a sensitivity to something, usually you put it on and it bothers them. I used to use argan oil that had lavender in it. And for some people, it was very warming and it had to come off. I mean, it just had to come off. So that's when I switched to something that wasn't as warming.
All right. And then is there anything in particular you recommend for somebody with a port wine stained birthmark on their face?
Makeup. You can't make a birthmark go away. I mean, no, you can't. I mean, unless it's surgically removed, especially a port wine. If it's something dark, then pearl powder can work, and bearberry. I mean, there are some things that work to kind of, I hate to use the word bleach, but lighten the skin. But the port wine stains are, just put some concealer on it.
So how long or how many treatments does it typically take to show a positive result? And then how much water should our patients be drinking?
The water question, oh my goodness. Well, I think people should drink enough water that when they go to the bathroom, it's not terribly dark. I think we as acupuncturists encourage our patients to drink really a kind of a preposterous amount of water. And that's just my opinion. I mean, our bodies really were not meant to drink gallons and gallons and gallons of water. It just wasn't that accessible to us throughout history. So, drink when you're thirsty and then drink a little more. But as far as, what was the first part of the question? That one.
How long or how many treatments does it usually take to see a positive result?
Yeah. So that, I get asked that question every time I teach a class. And it's kind of like saying, how many treatments until my neck feels better? Right? Because it's acupuncture. And I can say every human being is different. It depends on their nutrition, their lifestyle, their sleep, their exercise, their genetics. Are they yin deficient? Are they blood deficient? Are they qi deficient? Are they damp? Are they dry? I mean, all of this plays into it. Age matters, but not as much as you think, except it takes about 12 weeks for our bodies to make collagen. But when you're younger, you make more collagen faster. When you're older, you make less collagen slower. And that's why when you're old, skin doesn't snap back, and your elbows, your elbows, hang down, and you get the, the waddle and all that because the collagen doesn't replenish itself. You need vitamin C and protein to make collagen. And so I tell people, if after 12 weeks you're not noticing anything, then we need to revisit, are you drinking enough? Are you eating enough foods that are nourishing your skin?
All right. What can be done about hereditary dark circles?
Concealer. No.
Give me your answer for everything.
Concealer. Seems like the longer I'm in quarantine, the sillier I'm getting. So dark circles can come from one of two places. They can be a kidney deficiency, and they can also be, they can also have to do with the heart, because if you're Shen disturbed, you're not sleeping enough. And so really doing a good diagnosis can go a long way. Whenever I see someone with dark circles, I feel their pulses, I look at their tongue, so I do my diagnosis, and then I ask the questions. Some people, it is hereditary. I've had dark circles under my eyes since I was very young. My daughter has them. My parents had them. And thickening the skin under your eye, when I do facial cupping, I actually will do cupping right under the eye gently, without pulling the skin. And it helps to thicken it up, because part of the reason people have the hereditary dark circles is the skin around their eyes is very thin, so you can see all the little veins and capillaries. I can't diagnose you on one of these cameras. So.
All right, next time we have dinner, we're doing that beforehand. Okay. Let's see, next question. How about facial cupping for Bell's palsy?
How about it?
Is that part of your treatment plan for Bell's palsy?
Yes, absolutely. So I go over it a little bit. I just talked about it a little bit in this lecture, but in my facial cuppings, I talk about it a little bit. But I have recorded a webinar on treating neuromuscular facial conditions, and in that webinar, I talk about cupping, Gua Sha, microneedling, facial motor points, and submuscular needling to treat the neuro conditions like Bell. So in answer to your question, facial cupping is a big part of my Bell's treatments.
All right. You might cover this before getting to this question, but what about lining the area underneath the cheekbones?
What are the lines?
Or what about the lines underneath the cheekbones? So trying to get rid of them. Would you use cupping? Would you use Gua Sha? Would you use a combination of the two? Or would you not worry about it?
With all of my facial patients, I do needles, I do cupping, and I do Gua Sha. I'm not sure what she means by lines underneath. I've never seen like a line that goes this way. If she's talking about like sunken cheeks, then needling the medial pterygoid muscle back from gallbladder 2 is a possibility, and it helps to fill out the cheek area.
All right. Well, Melanie, if that did not answer your question, feel free to clarify in the question. Somebody asked, what is the significance of marionette lines?
Well, when I was talking about them, I was talking about the spleen, right? Because the spleen isn't holding the face up. So you see them a lot in people who are like an earth constitution. So that's kind of what those are all about. little earth deficiency going on there.
Alrighty. And why choose glass cups as opposed to plastic?
Because they glide better. I would never use plastic cups on the face.
Would you please demonstrate how you state UB1 with cupping?
I don't have my little baby cup because I don't really use it, but pretend this is a little baby cup, but just literally, you would just, can you guys see?
Mm-hmm.
I don't want to pull my eyeball out because this is a fairly large cup for that area, but that's what I would do with the little baby cup. Yeah.
So in that set, it comes with 4 cups. The one you were just demoing with it is the second. The second one from the smallest. There's one that's a little smaller than that.
Yeah.
All right, perfect. And the next question, do you only use jade or do you also incorporate rose quartz too?
I only use jade. I studied with Ping Zong, and that's what she used. And I figure if it was good enough for her, it's good enough for me. But she also did fire cupping on the face, so I guess she's also, I don't do fire cupping on the face.
I might skip that.
Yeah.
Next question, do we cup first, jade roll later?
Cupping, Gua Sha, and then if you're going to, I don't use a jade roller. I mean, I use it on myself. I have one in my office on myself, but cupping, Gua Sha, and then if you're going to use a derma roller, that would be the last thing that you would do, because you wouldn't want to derma roll someone and then start cupping them. That would be not good.
And then do you needle before you do the cupping and Gua Sha, or do you needle after?
I always do all my needling, and then the prize is the cupping and the Gua Sha. Yeah.
All right. For rosacea, do you only perform cupping or do you also include Gua Sha?
I do both.
And I do apologize to Aria Nielsen if she's watching, because I keep calling it Gua Sha, and I think she pronounces it Gua Sha. So I do apologize if I'm mispronouncing it. Next question, any concerns about glass cups breaking while using them?
Now these are pretty, I mean, unless you have a concrete floor in your treatment room. I was teaching in San Francisco a couple of years ago, and I lost 3 cups because they kept falling on the floor and the place had a concrete floor. But other than that, my cups they're pretty thick. I've never had a problem.
Yeah, those are very durable cups. They do not withstand concrete or very hard floors, but other than that, they are very durable. And then next question, I think there's a few questions on this exact same topic, and you did discuss it a bit. How do you disinfect a jade tool, as jade is semi-porous and can harbor bacteria even when cleaned? Yeah.
So what I do in my treatment room between patients is I use barbicide white, and barbicide kills everything. And then at the end of the day, I soak them in the Aculift sanitizing tablet solution, and that kind of gets in there and kills any bacteria that may be harboring in there. Because it has a little, these, I don't know if the ones you guys, these are mine. I've had these for years and years, but mine have a little tiny hole. See the little hole?
Yep, ours do too.
Okay, so, you definitely want to soak them, but, your patient's face is going to be clean before you start working on it. And I have those, my patients usually come with a clean face, but then I have, like the Aveeno, face wipes just to get all the makeup off, so there's not face cooties all over the tool.
All right, this question might be too state specific. The next question is, are we allowed to treat the face without a mask on?
I would check with your local agency and also with your insurance, now that I'm thinking about it. I would check with your insurance. I don't know if insurance is regulating whether or not the patient wears a mask. I mean, a lot of the practitioners I've spoken to, they wear a mask, but they're not requiring their patients to wear a mask. So I don't know.
And then you were showing earlier a little bit of kind of your ideas of doing the cupping on a face with a mask. You were, such a small window at that point. Do you want to maybe just kind of walk someone through that really quick?
Well, you couldn't cup over a mask, but you can do Gua Sha over a mask.
Oh, interesting.
Oh, yeah. Why not? Definitely. I mean, it depends on the mask. People have all kinds of crazy masks now. When I start, I've been collecting the surgical masks, which are very easy to get now. I'm not taking them away from anyone. And I'm going to ask my patients to wear those because it's not like this big cumbersome thing that I see a lot of people out in public wearing. But, you can definitely, at the very least, you can use a corner of the Gua Sha tool to stimulate the points. Again, when I teach, my methodology has to do with stimulating acupuncture points. So whether it's suctioning with a cup or whether it's stimulating with the edge of a tool, if they're wearing a mask, you can certainly use the edge of a Gua Sha tool.
Alrighty. And then somebody wants you to talk more about that plastic shield. And was that a table? I think
yeah, I got that on Etsy. And like I said, I don't sell them. I just found it on Etsy, and it wasn't great for my purposes, but if you're interested, I don't know if they can get with me or you. If you want to join my Facebook group, I'm having one designed, and I'm going to see if they'll gather like 100 of them, and just so that we can get them cheaper, with like smaller holes so that it's not so open and collapsible. So it can be traveled or put aside. You don't have something else big and bulky in your treatment room.
All right. Are Aculift derma rollers safe and effective to use on liver spots on the face and on the body?
I'm glad you asked, because the needles themselves are just long enough to go into the dermal layer, and it does a couple of things. First, so I don't know how many of you know people that are over 50, but I am almost 60, and I have can you see this? No spots on my hands, not a one. And just about everyone I know who's 60 has spots on their hands. And I attribute it to the derma roller because I do use it on my hands. But like the serum that I sell has vitamin C in it, I put it on my hands, and then I roll the serum, and it helps it to penetrate. But more than that, it helps to dissipate any excess, like if it's hormonal, a lot of times people get those spots. They're like hormonal spots, and sometimes it's old, dead skin cells. Those things, they look like, liver spots. Sometimes they're lumpy. It helps to exfoliate, so that it exfoliates. It brings nice, healthy blood up to the surface, helps the good products to get absorbed. They're just kind of good for everything. So, yes.
All right. What are the recommendations for practitioners with patients who have fillers and Botox and then wanting to do Gua Sha cupping?
So it depends on what it is they've had injected. There are so many different things that people can have injected into their face nowadays. So they have to have a discussion with whoever injected them. With Botox, you definitely want to avoid doing anything for at least 2 weeks. I would say closer to a month, because Botox can travel and you don't want to get blamed for something like, all of a sudden part of their face is paralyzed and it's your fault when you had nothing to do with it. So you definitely want to wait a minimum of 2 weeks, more like a month, after they've had the Botox, just to make sure that whatever they were having frozen is frozen. Then after that, you have to avoid that area, but they have to know where they had it. Sometimes people, they go to these Botox parties, they get a little tipsy, they start putting Botox in the forehead. The next thing you know, it's not just the forehead, they've got it here. Maybe they put a little here, they get it in their neck. So they really have to know where it was injected. And if you cup or Gua Sha over an area where they've had Botox, it's going to wear off. Same thing with needling. It's going to wear off. And filler, if someone has filler like here and you take a cup and you go like this, you could literally move the filler. So you definitely want to avoid that as well.
All right. How would you recommend disinfecting the bulbs of the cups? Is alcohol okay?
Like the inside this part, yeah. Sometimes, you can't pull the cup apart and just clean the glass part because you can't back together. So you could wipe.
You should be able to.
You're so comfortable to do that. I'm telling you, I've done it, and sometimes the little knobby thing, it breaks off. Or if it doesn't, once you get it apart, then you can't really get them back together again. So I tell people, if you nothing's going to get inside here. I mean, no face stuff is going up into the rubber part. But if you really want to clean inside the rubber part, what I tell people is go ahead and soak it in the sanitizing tablets or even some warm soapy water. Shake it out really well, and then put it on a baby bottle dryer so that it can drip out. And you definitely want to make sure there's no water in it the next day, because you go to work, like person gets a face full of water.
All right. What are the ingredients of the Aculift sanitizing tablets?
I used to know this one. It's a quiz show, right? Wait a minute. I just happen to have some right here.
You are very prepared.
Well, I might have done this once before. Sodium bicarbonate, citric acid, peppermint oil. So it's bubbly stuff, pepperminty stuff, and citric acid. So you could, you wouldn't want to, but it's non-toxic, if some of it got in the person's mouth or something. It probably wouldn't feel great if it got in their eye. But.
All right. Do you recommend Gua Sha and cupping on a patient with melasma?
Yes, definitely. Because again, you're helping to get the blood moving, right? So melasma has to do with usually hormones. You don't see it usually in younger people. It's usually older people, and then it gets worse in the sun. So it can really help to rise the pigment and get the healthy blood out there. I had some really good results with melasma.
Do you have any book suggestions for somebody who would like to learn more about facial cupping and Gua Sha? No books. If you go to my website, facialacupunctureclasses.com, I have a webinar just on facial cupping, Gua Sha, and microneedling. And the handouts, a lot of people complain, they are like a book because they're, you have to print them out. They're online, but you can print them out. And
I've written a lot of articles. I've written 2 articles in the Journal of Chinese Medicine. One of them talks a lot about cupping and Gua Sha, but I don't have any reference books per se. So,
okay. Sorry. And then somebody wanted you to remind them of the oil that you use for the face.
Oh, so Aculift. It's
that's new, not currently available for purchase.
Yeah, it's not on the L.AC site yet, but it's on my site. But
I think currently we have something similar, right? Which is through Gracefully Made USA.
Yes.
The super serum.
Very, very similar. So similar. Peel the label off and put the label on. So the Gracefully Made stuff, I private labeled it because I loved it so much. But it's almond, rice bran, sunflower, coconut, camellia, CBD, arnica, and that's it. And there's no preservatives or anything.
It's an amazing product line and an amazing manufacturer. So right now we do have it on our site. It's called the Super Serum. It's going to be in the link that you guys will all receive in the email afterwards with a link to Michelle's favorite products. And then Michelle, can you send me that cupping and Gua directions that you had shared about? Somebody was trying to find it on the website and could not find it.
Yeah.
So Joy, if you'd like to shoot me an email, and if anyone else would like this article, just send me an email. I'm putting my email in the chat right now. And Michelle will send that to me, and I can send that to you as soon as she sends it to me. Okay, and let's see. Which size cup do you use on the face? Do you use different smaller size in certain areas and larger in other areas?
So it just depends on the person's face. The smaller cup I tend to use around the lips, around the eyes, and in between the kind of get into those 11s. And the larger cup I'll use on the cheeks, working down the SEM. And it just depends on their face. Some people have bigger faces, some people have smaller faces. So I keep them both handy, and then I just, whichever one.
Okay. Would you be able to speak a little bit about over-nurturing?
Well, how much time do we have? So again, I don't think maybe I did mention, I don't know if I mentioned, classically, Worsley trained 5-element acupuncturist. So, over-nurturing can really deplete your earth, and it's just constantly tending to someone else. So you're just tending and giving, everything's going this way, and you're not taking in enough self-care, self-nourishment. So a lot of people now, I mean, I've seen some really, really funny videos, parents with their kids on lockdown all these weeks. And it, depends on where in the country you are, but we went on lockdown here like March 8th, and we still haven't opened up. The schools haven't opened, the daycares haven't opened, nothing's open. So a lot of parents are not tending to themselves as much, and they're taking care of 1, 2, 3, 4 kids. Some of them are taking care of pets and round the clock. Some of them are taking care of mates and needy significant others, or aging parents. So that's over nurturing would be taking care of someone else, some other living being, or even non-living being, beyond what's healthy for you. So, and we all have a different capacity for how much we can nurture. One of my patients has 8 children, and she's just been fine. She's like, whatevs. And my 2-year-old home from college, and like, what? When are they opening the University of Maryland back up again? So, Mom, can you, Mom?
The joys.
The joys.
Do you have any suggestions on how somebody can figure out what to charge for facial acupuncture?
Well, again, it depends on where in the country you are, but if you're going to do an 1.5-hour facial acupuncture session, I would not recommend charging less than what you would normally charge for 1.5 acupuncture treatments. Normal acupuncture treatments about, an hour. So most of my students around the country charge $150 to $200 for an 1.5 hours. So, you've got your pulse taking, the needles go in, the patient's on the table, the needles come out, all of that can take about an hour. And then the cupping and Gua Sha, it's another half an hour. So while your patient's resting on the table, you can go in the other room and treat someone else. And after doing this for a lot of years, I could conceivably someone on and off the table in an hour, but I try to make it a very restful thing. The nice thing about cosmetic acupuncture is it doesn't go through insurance, so you don't have that headache to deal with. And your patients, by and large, are healthy, and they're just relaxed. It's wonderful. It's very relaxing as a practitioner because you're not all in your head. Once you figure out what point you're going to do the very first time, you can pretty much make some minor adjustments, but do the same thing. So it's nice. I love it. Oh my God, I miss it. I've started treating. Where is she? Anyway, I have a face that I've been sticking needles in. A rubber face, not like a head. That sounded funny.
Alrighty, and then any concerns on using the same suction apparatus on the same patient?
I don't
so,
know.
do you have concerns now with the kind of the new times using the cups on different patients? So the same cup on different patients.
No, I'm just going to clean them. So they will be very clean. And conceivably, you could have 2 sets of cups and would be soaking while you're using the other one if you were really concerned. But again, they're glass, you're wiping them down, and yeah.
All right, so we are winding down. We have 3 questions left, and I'm going to stop it there. So first of the last 3, how to get rid of small facial red vein lines?
So if you're talking about broken capillaries, it's a technique that I teach in my class. I really can't get into it like in this. This is a cupping and Gua Sha webinar. So interested in how to treat certain facial conditions with acupuncture, I would recommend hopping onto my class this weekend. It's a live interactive class, and I go, and it's the whole class is like 26 CEUs, but I go in depth about protocols, diagnosis, contraindications, and a myriad of every line on the face. And I even the last piece is an advanced class, how to treat the neck and facial motor points, things like that.
And then for this class, if I'm not correct, you're also doing an option where if they take the online class, is there an option for an in-person afterwards?
Yes. So what I'm offering now is there's like 2 different ways to sign up, and you can sign up for the webinar only, and then you're done. do the webinar and that's it. Or you can sign up for the webinar with the option to take the class live anywhere I teach it. And as soon as it's safe, I'm going to be hitting the road because I'm used to traveling and teaching, and I miss it always. So I do have a live class scheduled for Calgary the end of August, and I fingers crossed that the border will open and I can teach it live. Otherwise, that will be a live stream class. And then after that, I think is Albuquerque and Austin, Texas. So.
Okay, and then we have, let's see, 2 more questions. What is the difference between or do you have suggestions for how someone would use a 0.5 millimeter versus a 1 millimeter derma roller?
So it just depends. It's not a how they would use it. It's more of a when would you use one versus the other. So what I tell people is if they have more sensitive skin or thinner skin or older skin, use the 0.5 millimeter. And over time, your skin will thicken up because it actually builds collagen. Your skin will have more substance to it, and then you can bump up to the 1 millimeter. And the 1 millimeter is more for younger skin, thicker skin, less sensitive skin. And if you don't know, better safe than sorry, go with the 0.5 millimeter. And you shouldn't press really hard. I mean, I didn't do a whole spiel about the how-to with the derma rollers because this isn't a microneedling class, but really gentle. You don't, more is not better with these. You're not supposed to bleed or anything, literally just like that. So no matter what the Kardashians are doing. I don't think he's like reading.
Sorry, I was like very engulfed in the questions and chats. All right, we're going to do one last question, and it is, do you have suggestions for procedures that you would use for hooded eyes?
I do, and again, that's several. If you're just talking about cupping in Gua Sha, just because that's what we're talking about now, you can use the cups to stimulate the acupuncture points around, even the levator muscle, which is right here. You can stimulate that. You can work gently around the area, around the forehead, because if you lift the forehead, right, you're lifting this whole area. But as far as needling, I have a whole protocol that I teach. And again, if you go to my Facebook group, I have little how-to videos, little snippets of how to do different things. There's like 8,000 people in the group, and it's a lot of how-tos and helpful hints. And so if you're not going to take my class, then you can pop on there. But I do have a whole protocol just for that when I teach.
Alrighty, and I looked it up. It is facial. It just says facial acupuncture, and that's the group name. So just look that up on Facebook. Facial acupuncture. That's it.
Yeah.
Super easy. And you just request to be added, and I'm sure Michelle will let you in right away. And then you can also follow her on her personal page, and it's always very funny. I look forward to your posts daily. Well, I think that's going to conclude it for tonight. Michelle, this was amazing. Everyone, thank you so much for attending tonight. Please check your emails 5 minutes after we end. There are links to these classes. There's links to Michelle's favorite products and a promo code for a discount offset products. Also, just to remind you guys again, I know it's been mentioned times, but June 6th through 8th, Michelle is teaching a class that was previously supposed to be hosted in London, but now it's going to be live streamed for everybody all over the world. So now we're going to reach more people than we originally thought so. So please check your emails. Please check out these classes. She has live recordings, really tons of great content. And, Michelle, do you have anything you want to say before we go?
No, thank you, Jeff and Lhasa. Always a pleasure working with you. You guys are great. And that's it. And thanks, everyone, for watching and asking questions. And too bad I can't see all of you, but everyone stay safe and healthy. And, yeah, wash your hands.
Thank you all. Have a wonderful night. And then our next webinar is actually going to be Tuesday next week, and it will be featuring Shelley Goldstein, and the content is going to be FaceTime, diagnosing and treating the aging face. If you give me half a second, I'm going to put that in the chat. Here is a link to that webinar. And now I will let everyone go and have a great evening. Bye.
Bye-bye.
Thank you.